We have used the term professional and performance voice for decades, but really they are slightly different things. A professional voice user is anyone like me, like a physician or a teacher or an attorney who is required to use their voice on a daily basis in order to interact with people to perform the function of their job. While it's true the attorney is performing for the judge or the jury and the teacher is performing for his or her students, it's not to the same level as someone working on the Metropolitan stage or on a Broadway stage where they have to use their voice to get and maintain the attention of the audience and to perform a different role than their native role. So we consider those people performing voice users, and they have specialized training because we require specialized functions or activities for their voice to do their jobs. The complications of voice is really occur when people overuse their voice or they try to make their voice into something that it's not, right? In a singer who sings music that's not quite fit for their voice, we're saying that their fach, it's referred to as their fach or their style of music that they choose. And they need to choose a style of music that's authentic. Otherwise, by straining to reach qualities in voice and notes in voice that aren't easy or authentic to them, they can hurt themselves. They can strain their voice. They can develop lesions. In the same way, a speaker or a professional voice user who talks too loudly too often or doesn't have good, efficient mechanisms of voice production will strain their vocal folds as well. These straining type injuries cause damage to the skin that lines the vocal folds. And then the body heals with calluses or with polyps sometimes or with cysts, whatever we call them. A lesion forms on the vocal fold, and then the vocal fold gets stiff and it can't vibrate like it needs to produce a good quality voice. The number one cause of vocal fold lesions and disordered voice is singing or speaking in an inefficient style. And so literature and research shows that if you correct someone's style of voice production, if you make it more efficient, the lesions at least 30 to 50% of the time resolve on their own spontaneously. You know, I guess it's not really spontaneous. The person has worked to improve their vocal efficiency. And that work then helps the vocal folds vibrate efficiently, and efficient vibration stimulates vocal fold health. It stimulates production of proteins and genes that call for healthy, soft vocal folds that vibrate easily and efficiently. So it is a cycle. So our number one goal when patients, professional or performance voice patients, or any voice patient comes in, is to identify the behaviors, the situations in which they overuse their voice or they use their voice inefficiently, and to work with them first to correct those. And we find that the majority of patients will get enough vocal improvement from that and will not so often need surgery. Our philosophy is really to help the patient find the inciting behavior, the behavior that was causative of the lesion, without blame. And we work as a team in an interdisciplinary model where the physician and the speech language pathologist and the singer of teaching see the patients collaboratively and together to help identify that behavior, and then to decide as a team with the patient at the center of that team um, what is going to be the best intervention for that patient to help them achieve their goals as quickly as possible and to be able to sustain them for as long as possible. So our goal really is, I don't want to say a quick fix. It's not a quick fix. It's a holistic interdisciplinary approach with teachers of singing, speech language pathologists, teachers of voice, and physicians. So again, patients on their first visit should expect to be seen by multiple clinicians, by both a speech language pathologist and a physician on the same day. Then we will have a conversation as a team. the patient, the speech pathologist, the physician, and try to identify the inciting behaviors, the harmful behaviors, the overuse behaviors with the patient. We'll come up with a plan together. We'll get buy-in from the entire team so that there's no miscommunication about what should be done. And if the patient chooses to undergo therapy as their first line of treatment, which is often my hope, we'll see that within 3 to 4 sessions, within a 6-week time of adopting these new behaviors, there should be significant change in the voice capabilities and in the size of the lesions, if any, are present on the vocal folds. So, the most rewarding part of my entire career is helping a performer or a professional voice user, or really anyone with a voice complaint, get better, resolve their problems, and resolve them so that they are now in control, to give them back control of their voice, to allow them to go forward and teach them physiologic principles of voice production so that they can be safe for the remainder of their lives and not rely on us. Really, that interdisciplinary approach, that teaching patients to use their voices efficiently, and the goal of maintenance of a lifetime of vocal health maintenance is what the Grabscheid Voice and Swallowing Center is all about.